Hey, welcome, Warwick. Thanks for joining us again this morning.
You're welcome, Karen. How are you today?
Yeah, look, doing pretty good. We're 10 days in now, and I think we're probably starting to feel it a little bit more. And I guess that's why today we want to talk to you about how we stay both mentally and physically well. This COVID isolation is something we have never experienced before. So, what things should we be doing, do you think, to stay well physically to start with?
I think those are really important issues to address because we do need to stay well during these several weeks of lockdown. So I think in terms of what we're eating, we should try to eat as healthily as possible. You know, the temptation is to land on the couch with a slab of chocky and a soft drink and watch a video, and that's fine once in a while.
Yeah.
But I think if we do that too often, we're going to come out of this weighing a bit more than we went in weighing. So that's not ideal. So I think trying to eat healthily as much as possible is a good start. I think if you want to drink something, drink water as your drink of choice, because that way again you're not having the calories associated with other beverages. And in terms of food, just eating simply, So I know at the moment it can be tough to get to the shops, and there's long lines, and prices seem to be a little bit more than they were before. So, but yeah, pick what's in season, pick what's made in New Zealand or grown in New Zealand, and try to have that. Eat the rainbow colours of your plate, So make sure you've got all the colours of your plate going there. And then try to do some exercise, and that can be tricky. My family laugh at me a lot because I spend quite a bit of time on the phone. But my trick to doing that is I walk around our dining room table and manage to get my steps up that way. So
Yeah, I'm with
if
you,
you're on the phone, if you're on the phone, walk. Don't. And even if it's just up and down the passageway or the corridor, it gets you off your buttocks. So I think that's a good idea.
Hey, I even do it on the spot, and yep, I become the butt of my family's jokes as well. But yeah, it is. It's a way to keep busy while you're doing something else. Hey,
and get outside for some sunshine. I mean, we're allowed to go and walk. We need to keep our distancing when we do that, and we're allowed to even bike ride and so on. But just again, the message of staying home, stay local. But yeah, we've been. While we're in a drought, at least we've got some sun and so warm, and we can get out and enjoy the outdoors before we get into deep autumn and winter. So let's make sure we get some outdoorness, get some vitamin D from the sun, and there's nothing like a bit of exercise to get the endorphins running and for people to just, hey, I can take this on again. And so I think it's really helpful. The other thing I'd just say, about the physical health. Is don't underestimate the importance of a routine. I think that's really important to our physical health as well as our mental health, actually.
yeah. Well, it's interesting that you say that, because when you talk about sunshine and even the exercise, Warwick, I think that also great things for our mental health. And that's what we want to talk about now is our mental health, because we are currently largely stuck inside day in and day out with the same people. And that can be really tough, especially when we're not used to that. Some of us are parenting and teaching and working all at the same time. So what can we do to stay both mentally and emotionally well?
Yeah, I mean, I think it's very challenging to have lots of people in the same house all together all of the time. And I don't think we should underestimate the challenge. And I think that what we need to do is to face up to those sort of feelings that we're having and those challenges that we're having. It's no good just sweeping them under the carpet. There's a little update that's gone out that this week called Facing COVID by Dr. Russ Harris. And I think it's got some really practical ways and tips that we can use to keep us mentally and emotionally well. But, acknowledging the way we feel, I think that's very important, and thinking about ways that we can control what we can control. You know, we can't control what the government's doing. We can't control coronavirus. We can control our behaviors, and we can control what we're doing here and now. So, you know, limiting the amount of news time we watch, for example, just doing it once a day, turning off the news notifications, and just trying to control what we can control can be very helpful. And sort of being present, you know, being present where we are at the time. So, yep, lockdown's hard, but hey, we've got time to do things we might not have had time to do otherwise. Time with our family we might not have had otherwise. So let's try and use the positive, and let's see what we can do to come out stronger out of the other end of this. Yeah, I mean, I think there's lots of things that will help our mental and emotional well-being. And we talked earlier about the physical stuff. So rest and eating help our mental and emotional well-being. Don't stay up to all hours of the night watching television. If you drink alcohol, I would suggest that you limit it or try to avoid it, because alcohol in these confined spaces is not great. So limit that and any other drug use as well. Let's just be sensible and try and make the most out of the conversation we have. And read Russ's handout. It's really practical. It's very easy to do. And I'd really encourage people to do that.
Yeah, so Warwick sent that to me earlier this week, and we added that to our e-update. So it's one of the useful links that came to you on Thursday. So do that, because it is awesome information, and a lot more things on how we can stay mentally and emotionally well. Well, that's it from us today. So again, thank you so much, Warwick. We are grateful for your wisdom around this whole thing. And you go and have a great weekend.
Thank you very much, and to you too, Karen. Ka kite anō.